Visiting the clinic is a little more complicated when your child is on a ventilator. You want it to be safe, easy, and manageable. So here are a few tips from the nursing staff and from caregivers. Number one, be organized. You want to be on time, so consider the time of day and the traffic you might encounter. Make a thorough list of the equipment and medications you need when you venture out of the house.
Make sure you have all your equipment. First and foremost, of course, your ambu bag. You don't want to be caught without that. Make sure you have your ventilator, have your backup battery with you, have extra tubing. If it's time to give treatments, of course, you bring your treatment equipment with you. Bring your medications if you want, because we don't carry all the medications that all the kids are on.
Whenever I make an appointment, I try to be here on time. I bring all my notes. If Jonathan's having any problems, I let him know.
We have a flow sheet of information on how his ventilator is working. You know, every night we record some details. So when I come in for an appointment, I just grab that sheet, show the doctor. He's got what he needs. I'm not trying to interpret it or stress over, am I giving accurate information? I have just very simple little logs, and each has a little category.
Bringing a list of current medications and doses is a good idea too. Just as you need to be organized on your end, you might be interested to know that the staff at the clinic has its own organizational approach to visits.
Let's see, who do we have this morning?
Every morning we do get together and we look over at the list of names and which patients are going to require which type of care, what type of room they're going to need, what type of setups we're going to be planning ahead of, making sure those things are ready to go when that patient gets here.
Hi, good morning. Hi, how are you? Hi, Joe, how are you? Oh my goodness. Jonathan, how are you? Look at the big smile. Let me wash my hands before.
Clinic visits can take a while since you'll often see several members of your team besides the doctor. You could see a nurse or two, your social worker, and a dietitian.
Perfect. Now, as you know, that nutrition is very important for Jonathan. So today, besides myself, dietitian will come. Okay, I don't know.
Children on vents can grow just like every other child, but they may need to use special foods or equipment, and the caloric requirement may vary depending on their medical condition. That's why the dietitian is a key member of the HMV team. We're including a full description of nutritional tips and guidelines in the attachments. The topics in this special section include nutrients, supplements, aspiration risk, and constipation management. You can access the attachments on this DVD on your computer. Now here's another aspect of your clinic visit. At Children's LA, patients are encouraged to use the clinic's oxygen and power at an appointment. It just takes a few reminders before caregivers start doing this automatically.
If the child needs to be on oxygen, they turn off their oxygen portable tank, they come in here, they connect their own tubing and do it themselves. They'll take their ventilators off the battery mode, connect it, plug it in, so it's charging up. So in that case, it's a real safety issue, and we always remind them, don't forget you have free use of our equipment here, because we don't want them to be without battery on the way home. That's not a good thing. So while they're here on their visit, and they can be here from anywhere to 45 minutes to 2 hours, 3 hours, depending if we have a very complicated visit, their machine's plugged in, so that's being charged up. So we know we're going to send them home prepared without complications.
The bottom line is, when you're organized with your equipment, medications, lists of questions, and transportation, then everyone's attention can go where it ought to go, to your child. We have one more chapter about home ventilator care, and it's the story of an amazing young woman named Ashley.